All right, so thank you everyone for joining us. I think we're going to get started now. So we are Northeastern's Healthcare Innovation Core. We are ViTAL, and if you want to join our newsletter, we have monthly newsletters that go out to people's emails. And if you do join the newsletter, also keep a lookout for your junk emails and Outlook because sometimes they do go in there. But yeah, the QR code is in the bottom of the screen if you want to scan that before we move on. Okay, so who are we? So ViTAL is basically an interdisciplinary collaborative of students united around healthcare innovation, the growth of healthcare, the future of healthcare. And we grow together to develop in knowledge, connections, and skills outside of the classroom. So how do we do that? So we do this by hosting guest speaker events of leaders in the healthcare field in a variety of different areas. And we host professional workshops, networking events, field trips to company headquarters. And we also have the opportunity to build and join healthcare ventures. And all of those, which I just mentioned, are things that you're going to hear about as this presentation goes on. And as a team, we come from a wide variety of majors. So we have neuroscience majors, we have data science majors, health science majors, finance majors, industrial engineering majors, pharmacy majors. So we have a very diverse team, and there's room for honestly anyone. And because we're so diverse, I think it helps the community aspect because we all learn from each other. We all have different specialties that we're studying in college, but we also can leave room to learn outside the classroom from not only ourselves, but also our club. So the name ViTAL, right? To empower the I, the impact each individual can make in healthcare. So as college students, right, we have classes and we're kind of bogged down with what's next, what do we want to do in life. But what ViTAL really wants to, what we provide as at ViTAL is basically a way for us as college students to learn more and do more outside the classroom while we're still in college, and to make an impact in healthcare as college students. And so this is our team of directors. So the top row are the directors who we're all here today and we're all going to be speaking. And then the bottom three are our advisors. So my name is Christopher Hahn. I am the executive director of ViTAL. I'm going to be a fourth year BNS student, so behavioral neuroscience student with a minor in business administration. And I currently just finished summer classes.
Hi, I'm Hino. I'm the Director of Ops. I'm also a rising fourth year and BNS major as well. I'm minoring in political science and I am currently on co-op.
Hi, sorry my camera's not on. I'm having technology problems, but I'm Elisa. I'm going into my senior year studying industrial engineering and I'm currently on co-op at Apple. And I'm also the director of special events at ViTAL.
Hi, I'm Nirban. I'm going to be a rising third year health science major with a minor in business analytics. Not on co-op right now, but wrapping up an internship at United Health Group and one of the co-directors of Ventures.
Hi everyone, my name is Lynn. I'm one of the co-director of the Ventures team, and I'm a rising fifth year student studying finance and accounting. Currently, I'm also wrapping up my internship at Amgen. Nice to meet everyone today.
Great, and then to quickly introduce our advisors. So we have Dr. Kevin Scanlon. So he is our faculty advisor. He is a professor and lecturer at the DeMoore McKim School of Business. And then we have Lloyd Bishop and Philip Summer, who are both our advisors from HSE. And HSE stands for Health Science Entrepreneurs. So it's a group inside of Bouvet that really just helps out students or faculty or alumni, anyone affiliated with Northeastern who has an idea or has a healthcare venture. And HSE kind of acts like their mentor and acts like their guide towards navigating the space.
All right, so I'll talk a little bit about the operations team. So basically our team's focus is to host speaker series and bring in leaders in the healthcare field. And that is mostly in an attempt to educate, inspire, and kind of innovate our student audience to think outside of the typical healthcare realm and just see how different people within the ecosystem, not even just in Boston, but like around the country, are able to make an impact. And that could be in various ways. One of our most notable speakers that we had in our spring semester was Dr. Tal Zaks from Moderna. He is their CMO. So he actually got a chance to speak with him right before they announced, or right after they announced that they were going to be taking on the COVID vaccine, which was a really great experience. He brought a lot of light to his past experiences and just kind of his journey to Moderna. And it was great to hear from him. We also have brought in Dr. Rushika Fernandez-Hilly from Iora Health, and we're really looking forward to our upcoming speaker series this fall. So we're going to be announcing the topic of that speaker series at our kickoff event on September 17th from 6 to 7 p.m. I'll tell you a little bit more about that a little bit later. But yeah, our team is below. A few of our members are joining us today as well. So if you ever have any questions about what our fall and spring semesters are going to look like, feel free to reach out to us. We are more than happy to talk to you about it and get your insight on what you kind of want to see.
Hi, so I'll be introducing a special events team, and our team works to design programming to increase engagement with the greater healthcare entrepreneurship space. So things like volunteering, community bonding, professional conferences, and we're really excited next spring to be hosting the Husky Health Innovation Challenge, which is a case challenge for everyone to get hands-on experience pitching solutions to healthcare problems in a professional environment. And our team is also from like a diverse variety of backgrounds, all the way from like the sciences to having minors in like finance and everything like that. So we're really excited to host some community bonding things this semester and then move into next semester where we'll have the innovation challenge with cash prizes.
Yep, I can talk a little bit about, introduce a little bit about the ventures team. So our team focus is to help students engage in experiential learning opportunities with healthcare innovation companies. So this summer, we actually are working on a project with Momentum on to help them with their go-to-market strategy. So just give you a little background about the company and what type of project we are working on. So the company, they provide AI-enabled orthodontic imaging tool and braces kit for general dentists. And we help them to go and answer three main questions. Number one is, who should they target? Should they go after the general dentist or the orthodontist? And the second question we also help them with is whether they should look at like the general dentist population in urban area versus rural area. And third, last but not least, we also help them to develop to look at their value proposition and see how they can communicate the values that they can add to not just the patients, but also the general dentists. So all in all, the vision for our team is to have to provide the students with hands-on opportunity outside of the classroom by participating in a semester-long projects. So in spring 2021, that's when we will kick off this this project. So please stay tuned and be in touch with us, because we will definitely have a lot of exciting projects for students to work on. Mm-hmm.
Cool. And then before we go on to the more casual conversational and Q&A part of this info session, I'm just gonna quickly describe our mission on campus: to inspire, to connect, and then create. So inspire, really just to inspire students like ourselves, as well as other members of the Northeastern community, to learn more about healthcare and to want to make a difference in driving healthcare forward, right? Because that's why any of us have any kind of major or want to do any kind of job that's in healthcare, right? Is because you want to treat people, you want to get people better, you want to improve patient outcomes, decrease costs, improve efficiency, stuff like that. right? So we inspire people as students by hosting events, and like you just saw, and then we're also part of the Mosaic community on campus. So the Mosaic community is basically a group of clubs on campus that are all entrepreneurship oriented, and they're all great clubs. If you have time, you should definitely check them out. And then we connect. So we connect students like ourselves with each other, right? Healthcare is not the biggest field of Northeastern, I'd say. And then healthcare entrepreneurship is definitely a smaller kind of niche field. And so those of us who are interested, we do join ViTAL, and it creates a bit of a community. And it's pretty cool to see. And we always get like the students who say like, oh, I've been looking for this since I started Northeastern. And I'm so glad to finally found it. So those are great stories that we like to hear about. And then we connect students like ourselves to health science entrepreneurs. So if I didn't actually join ViTAL, I would have never heard about health science entrepreneurs. But after knowing about them and knowing the kind of mentors they have, it's definitely great people to learn from. And then to create. So like you just heard about, Elisa saying, we do have the Husky Health Innovation Challenge, which is a case competition that we host on campus by the students for the students kind of thing. And then we have the ventures team, which really goes out there and works with ventures, smaller healthcare startups, and just does some consulting work and really gains a hands-on experience while helping out a company at the same time. And then, so we want to keep this info session super casual. And so we did want to just kind of open up the conversation to everyone here today. And so if anyone wants to answer questions, I guess we'll go from the first one down. So what kind of aspects of healthcare are interesting to you? Just to kind of open up the conversation.
I think I saw someone raise their hand. Just feel free to unmute and just speak.
Chris, do you want to start?
Yeah, sure. So let's talk about let's talk about like telehealth, for example. So with the COVID vaccine or the COVID pandemic going on, less people have been able to go to the doctors for like things such as general surgeries, and then they've also been less motivated, I guess, to go to like checkups, to where there's actually no intervention involved besides just like talking to the physician and whatnot. So I think it's interesting to think about after this pandemic ends, given the funding, the resources, and the kind of let's say clout that telehealth services have gotten through this pandemic, will we see the resources and the same interest being shown by patients, providers, and payers for telehealth after the pandemic ends? If we do see the same interest by all those that I mentioned, then it'll be interesting to see what happens within that industry. But if we don't see that interest, it'll be kind of interesting to just see like, oh, telehealth was here when we needed it, and now it's just going to come back and take a back seat to what healthcare or what the operational side of healthcare has been like in the past. It's just a thought I had and something I wrote about in my writing class. So. Cool, let's just go with the directors then.
I can speak a little bit off of a tangent for that. So something that we've been talking a lot about at work is the aspect of, will this kind of carry into changing how the work field looks? So I know that if you are in any year, really, like after a sophomore and you're looking for a co-op, that's going to probably impact what you're thinking about doing, especially if like you are in the healthcare field. Sorry if you hear like that noise in the background, just ignore it. So for example, my co-op was originally supposed to be in person and now it's work from home the entire time. So I think that really changed how I kind of saw what I was doing. And if you are, for example, a nursing student and you do have to go in and work in these hospitals, how does that change how comfortable you feel or how much you're more likely to do more of a clinical based co-op? I think that's definitely something that more people are going to be thinking about. And depending on the precautions and the ways that Northeastern handles it, as well as just like the general government. I think that'll change a lot about kind of how everyone's perceiving the situation.
Yeah, I think that's a really cool point. I think the other thing that's really interesting about healthcare is how, I mean, we talked about how interdisciplinary we are, but how there's so much in healthcare that you can get involved in. So like, some people that are really policy oriented, could be just doing health policy for their whole career and, working at the White House, Capitol Hill, doing their thing. But then there's like the other realms like technology, like digital health, like if you're interested in, the intersection between AI and machine learning and healthcare, there's a huge space for that. And then everything in between, right? Like the business aspects, you have consulting, you have, sales, business development, marketing. So I mean, healthcare is like, we see how robust healthcare is as a field, right? Like even with the global pandemic, I mean, agreed that, that's healthcare related, but still like, healthcare hasn't missed a beat. I mean, companies are doing phenomenally. If you look at like their earnings and how the stock market is doing, especially like the healthcare industry. So I'm just like, I just urge you guys to keep your minds open because, I can personally say that I came into school wanting to be a doctor and, now I'm like very interested in like health policy, but I'm also interested in, the intersection between, innovation, business and healthcare. And that's why I'm, really interested in this whole consulting piece. So sky's honestly the limit. And I think you guys should really just take your time to explore different fields. And I think with ViTAL, you'll definitely get that through our speakers and actually some of the activities that we do, including the ventures consulting as well. Does anybody have any career aspirations?
Does anyone have any questions for us about kind of who we are, what we do, why we got involved, if you're kind of on the fence about why you should be joining this club? You can also put them in the chat if you're not comfortable with like speaking the questions.
What time does ViTAL meet? Like what day of the week, what time, how often?
I can speak for the speaker series because those are like our most planned out events. We tend to meet on Thursday nights from 6 to 7 p.m. Eastern. Everything this semester will be virtual. So if you're not on campus or don't feel comfortable joining us, no problem, it's all online. We will have a few collaboration events that might not take place in that 6 to 7 time slot on Thursdays. But for right now, we are meeting almost every Thursday this fall. And if we aren't meeting, then we will let you guys know. We do try to implement a lot of volunteering and community bonding this semester. So there's stuff outside that Elisa can also speak to. But in terms of like online sessions of like meeting with the speaker and interacting, it'll typically be 6 to 7 p.m. on Thursdays.
Okay, thank you.
Yeah, and just to add to that, like the community bonding and volunteering stuff is kind of going to be more on an ad hoc basis because it's all virtual. So for example, like one of the community bonding things that we're going to have on our Slack, which I don't know if you can join it through our newsletter yet. Maybe Hino can talk to that. But basically, you'll be able to be matched with other people within our club and then plan like coffee chats offline, like online on Zoom or something, but just have the chance to connect with people individually within our club, kind of based on whenever you guys' mutual availability is. So we'll be doing things like that. And the Husky Health Innovation Challenge that's in the spring, you have a couple of weeks to work on this challenge, and then the pitch day finally culminates on a Saturday.
And for the venture team, so we kind of have our own schedule because, as you know, we are working on a consulting project for like a real company. So it like how many meetings we have per week will varies from week to week based on like what information or who we want to meet in that week. So just give you like a sense of how our week is structured. So we work with every 2 weeks we will have a meeting with the CEO of Fermentum, the company that we are working for. We also every week we also have a check-in with our advisor from HSC, just to have them helping us with the whole direction with the project. And outside of that, we also have to talk with a lot of other external stakeholders, like people from the board of registry in dentistry, to get stats around the dentist population. We also talk with some general dentists and those who are considered as the company's potential customers. So it vary from week to week, but I think it's very interesting to kind of have that opportunity to talk with a lot of people, and at the end of the day, after talking with them and meeting with them, you want to be very focused on what you want to get out of that conversation and how that can contribute to the final deliverable of our project. So yeah.
Anyone else have any questions? Anyone want to answer the other two questions? How can ViTAL help you in your healthcare journey? Or what are some events that would interest you?
I can answer the second one. I think I'm interested in joining ViTAL. I'm a rising freshman, just to really gain exposure to lots of different topics and just see. I'm a rising bio major, but I'm thinking about the health science business combined major. Not totally sure, but I'm hoping that first ViTAL can kind of help me see if that's something I'm interested in, and also just gain exposure to a lot of different more niche fields within healthcare and just see what areas are really interesting me.
Yeah, I think the comment on that. So how I joined ViTAL, so it was still the Northeastern University Healthcare Business Club when I joined. So I was 2 years ago, and I was at Fall Fest just walking around, and the director just approached me and asked me if I was interested in healthcare. And I was like, sure, why not? And I want to be a doctor. And so he was like, you should come out to the club. So I did. And the first event was this, the entrepreneur who started a company called Contacts, which is expanded now. But back then they did eye tests on your phone, and you could basically fill your contact prescriptions over the phone instead of having to go to the doctor's office. And to me at that time, I had no clue about telehealth, or I had no clue that stuff like this was even possible. And so that kind of got me interested in just coming to the different events. And so for my first semester of being a part of the club, I just went to every event, and I was like, it's only 1 hour out of my week, and I'm going to learn something that I didn't know about. And by the end of it, I learned so much, and I had memorized every speaker's name, what they did. It's a bit crazy, but yeah, if you just you as a freshman, you do have an hour, or as a sophomore, you do have 1 hour of spare time in your week, and so this would be a great use of that. So
to speak to the more different aspects of healthcare that you wanted to find out more about, we do a speaker panel of co-op students who are doing non-traditional paths in healthcare co-ops. So for example, last semester, I was also on the panel. I did clinical research, which isn't very typical. I'm pre-med, so it wasn't the most typical thing for me to do because it wasn't a wet lab situation, but I really enjoyed it and I loved talking about it and learning about other people's co-ops. And so we, for example, had someone who worked at Third Rock, which is a venture capital company that funds startups, I'm pretty sure. So we had more of the business side. We also had someone who did work more in the AI digital side. We had someone who was industrial engineering, worked at Beth Israel, and we also had a graphic designer from Dana-Farber. So we really kind of nailed a very, very broad spectrum of co-ops and just people who are from very different backgrounds who may not necessarily even be active members of ViTAL, but do come when they can. And their niches within healthcare are really specific to what they have a passion for. So for example, for our friend who was a graphic designer, she loved graphic design. She loved designing things on the computer, and she was comp sci, and then kind of like meshed that with her desire to do something more art related. And she ended up at Dana-Farber, kind of not intentionally, but she was interested in kind of seeing more about the healthcare space. And now she really enjoys it. And she'll be graduating soon, and she's considering working in another healthcare company or hospital system. So I think there's a lot of room to kind of learn about how other people are gaining experiences within the realm itself. And I can like speak for myself in that I had no idea that I would be interested in some of these jobs, and I ended up applying to some of them that they were speaking about. So I think it's a really great firsthand way to, even if you're just attending the events and speaking with people that are sitting around you, I think a pro of being in this club is that it's so interdisciplinary that even if you talk to one other person, there's a low chance they'll be the same major as you, and their perspective will definitely be different based on what they're learning. And that's been one of the most fruitful things that I've gotten out of the experience, because kind of like Chris, I was just kind of like trying to figure out what I wanted to do. And I was pre-med, but I wanted to kind of venture outside of that a little bit. And being a neuroscience major, it's very like, there's things set in stone about what you're going to take and what you're going to learn. And I wanted to venture outside of that. And this club helped me do that. And I never thought that I would be interested in the more entrepreneurship, innovative side of things. And now I work at a startup accelerator. So it really kind of switched my direction. And I still have very strong plans of going to med school, but I think the perspective that I'll have and I'll be able to bring to my time in medicine and my career going forward is definitely going to be more well-rounded now that I have more of this experience to speak from. Also in the chat, Elisa asked if some of you guys want to share what your majors are, kind of give us a little bit of insight about who's interested about joining.
Hi, I'm Carissa. I'm a rising sophomore. Originally, I started out as a health science major, but I quickly realized that health policy wasn't for me. So I'm switching to CS Bio, and while I'm looking, I'm considering doing pre-med, but I still definitely want to explore the intersection of healthcare and technology, just because I know that there's a huge growing field. And I think that ViTAL definitely has that aspect with being more innovative, because a lot of the people that I talk to currently are based only in health science or straight CS. So it's hard to find a balance between the two.
And going back to Elisa's point from earlier, if you do join our newsletter, we're having one going out tomorrow. And if you wanted to join our Slack from that, or if you visit our website, there's a link to join our Slack from there as well. We try to have an ongoing conversation kind of in there. And if you ever wanted to kind of like bring up a topic that you found was interesting, that'd be a great place to do it. And especially if you have a question about that, we'll definitely try to open that forum up to all of our new members to kind of discuss. And Dina, I saw you about to talk, so go ahead.
Sorry about that. I'm also a rising sophomore. I am a health science and business administration major, and I'm kind of looking at what I want to do in sort of the intersection of those two fields. So I feel like this could be really helpful in narrowing down some of those more niche interests that cross over.
Yeah, definitely. Health science and business. That's like, I'd say one of them, not the perfect combination, but a very good combination if you want to be joining the club and learning more.
I'm Shira.
Oh, sorry. We overlapped. Go ahead.
Okay, I'm Shira. I'm also a health science and business major, concentrating in supply chain. And I've known about ViTAL for a little while, but I haven't had time to join because of other clubs I've been involved in. But it's looking like those won't be available for the fall because of COVID, so I thought I'd become more involved.
Yes, now I can go. Hi, I'm Maria. I'm a rising third year at Northeastern, and I'm a business and psychology major. I've been interested in the biotech industry, I'd say, or just the biopharmaceutical industry in general for a while now. So I thought that it would be a good club to join and learn more with your speakers and everything to get more familiar with the industry and just what it's all about.
Can I say something for real quick? you're muted, you know.
Oh yeah, go ahead. Sorry, I
Yeah.
didn't know who was speaking.
Hi, Carissa, and who was, I don't remember who was the one who, Maria, yes. So my name's Payden. I'm the co-lead I'm the co-lead for outreach for the operation team, and I am a third-year data science and health science major. So I'm kind of like the like my major, it's like the intersection for technology and health science. Um, and I'm currently co-oping at a pharmaceutical company. So if you guys have any questions about like the intersection or like how is it being like in the CS college, but also like in Bouvet, like feel free to reach out to me. Like we can talk more about it. Yep.
Thank you.
Yeah. Thank you guys for coming.
Thank you so much.
Thank you for sharing, Ada, in the chat. I appreciate you kind of like putting it in there. But yes, definitely bioengineering. If you have any engineering questions, I always direct them to Elisa because she is our resident engineering major. She's industrial engineering and she loves to talk to students about it. I'm like putting words in her mouth, but she's definitely here. But I just know that she gets really excited when we have engineering students. So definitely feel free to reach. I just want to reiterate that we love talking to students and we love talking to people in our club. We get super excited whenever anyone messages us. I had someone message, like LinkedIn message me the other day. Also, like connect with us on LinkedIn. We're all on it. I had someone connect with me after the last info session, and I was really excited about it because I'm like, yes, I get to talk about this because I really do consider myself like not someone who's very innovative, and this club has like not fostered innovation in me to like make my own product or anything like that, but it has fostered innovation to think outside of the traditional realm. So I love talking about that and just sharing that with other people to kind of get them involved as well. So if you ever have any like questions about our lives, what we're doing, or just kind of anything about ViTAL in general, feel free to message us. You can text Elisa.
And then a last question: are there any kind of? Oh, just kidding. That's so I'm not sure if I'm pronouncing your name correctly, but Humeo. Yeah, thank you for responding in the chat. It's cool to see that you're also a BNS major. When I was an incoming freshman as a BNS major, I did not know about any kind of healthcare club on campus, nor was I looking at that time. But it's good that you're starting out early, honestly. And also, I'd say that a lot of BNS majors, I hope you can hear me too. I feel like I'm just talking to myself, but like a lot of BNS majors are really oriented in the neuroscience of it, which is really cool. And it's definitely something to look into, but it's cool that you're also like going outside the box a bit as a BNS major, still getting that hard technical science degree. Last question before we wrap it up. Are there any events that would interest you? Just any kind of ideas that y'all would be interested in? You know, as students, we're in a really good position because any kind of company, any kind of anyone who works at a company would be interested in coming to Northeastern and speaking to us because we're students. You know, it helps us because we learn more about them and their company and their journey, and then it also helps them because they get let's say, like, I wouldn't say free press, but something like that, you know, and first dibs to like future workers who might join their company.
I'll just kind of reiterate what I was saying earlier about our meetings will be every Thursday, most likely from 6 to 7 p.m. There's a few Thursdays that are not accounted for yet, but they will be accounted for. So just if you needed a time slot to put in your calendar, 6 to 7 p.m. Thursdays. And then our kickoff event is again on September 17th, and that's when we will be announcing our topic for the next semesters. It's kind of our umbrella topic to focus on in terms of what kind of speakers and leaders in healthcare we're going to be bringing in. And it's very pertinent, and I think everyone will be excited about the topic. I know I am, so we hope to see you all there. We're also hosting another info session at Fall Fest, so throughout the day we'll also be available then if you have a question that pops up and you want to speak with us. You'll get to meet the rest of our e-board there as well. We'll be interspersed throughout the day. So if that's something that you're thinking about attending and just want to drop in, we'd love to see you there. And then I'll hand it to Ventures and Elisa to kind of talk a little bit more about our spring.
Yeah, I can talk about what's going to happen in the fall, I guess, at a high level. So basically right now what we're doing is we're just wrapping up our consulting project for this company. And then hopefully in the fall we can show you guys what we've done and give you guys a better sense of what direction we're headed in. But throughout the fall, there will be little nuggets of healthcare consulting to keep you guys plugged in and just learning more about the field. And then come spring, we'll be looking to take applications for our next consulting batch. And so you'll find out more about that process when we get closer to it.
And then to speak a little bit on the Husky Health Innovation Challenge. So this will be held sometime in March, most likely on March 27th. So teams will have a couple of weeks to prepare for the competition in advance. And all are welcome to join regardless of major. If you don't have a team, we can assign you one. So it's really an opportunity for everyone and anyone to have a chance to get exposure to a hands-on project in healthcare innovation. And we will not be announcing the topic necessarily until the case is released, but right now we're working in the planning stages and we're really excited to host it next semester.
And if you ever have any questions about kind of anything we were talking about today, I definitely urge you to visit our website. It's up in the chat, and it's also just northeastern.edu/vital. All of the events that we've had in the past are kind of listed out there, as well as a little brief introduction to HHIC and Ventures. And so if you have any questions based off of that, you can also email us from there or follow us on Instagram and DM us. We're pretty receptive on all of our social media platforms. So whatever works for you works for us.
Cool. And with that, I think we're going to wrap it up. Thank you, everyone, for joining us at our second info session. So we're going to have our first kickoff event, as Hino mentioned, on September 17th. So if you want to learn more about the club, we're going to go even more in depth at that event. And yeah, please feel free to connect with us on LinkedIn, Facebook, and Instagram. And thank you again for coming to our info session.